So, like all of you know, that you must be at a very crucial juncture in your life where this decision which you take will take your career forward, and your life's professional career depends on the decisions you take now. So basically, I always keep telling that unless you have a goal, you will not be in a position to actually reach it. So goals give you a starting point and a destination to reach. And at the end of this session, I expect you to write your goal so that it helps you to clarify what you desire to do and understand the importance of pursuing them. So at least we should have it in our mind that we are going towards something, and we have to reach a destination. So, of course, the common goal for all of us is Allah's pleasure and service to mankind. Other than the professional part of what we want to do, this is a general thought process that in whatever we do, Allah should be happy and it should serve the mankind so that whatever we pursue is worthwhile. So, with healthcare, the advantage is that this is a hadith of Prophet Sallallahu Alaihi Wasallam that whenever a sick Muslim brother visits, whenever a man visits a sick Muslim brother, he walks along a path in paradise until he sits, and when he sits, he's cloaked in mercy. And if he comes in the morning, 70,000 angels pray for him until evening, and if he comes in evening, 70,000 angels pray for him until the morning. So basically, we are blessed to be in a profession which gives us so much of sawab, and Allah Ta'ala has promised so many good tidings with people who are doing the service of others. When the person just visits someone, he has 70,000 angels praying for him. So imagine the number of people imagine the number of rewards for the people who actually are involved in taking care of the person involved in the treatment. So anyways, in India there's been a healthcare crisis which over the last 15-20 years people are working towards mitigating and increasing the number of doctor patient ratio. So, career in medical sciences broadly, you can see that medicine, surgery, which is the core MBBS program, then you have dentistry, then you have Ayush and allied health sciences, pharmacy, and nursing. So, these are the broad specialities which the career in healthcare is divided into. So, NEET entrance examination, which is a centralized examination with about 20 to 25 lakh students writing all over India and qualifying for this examination. This is a standard examination for all MBBS admissions in India. And there are certain criteria which I'm sure all of you are aware of. And there's a cutoff marks, and for general category, it's 50% and OBC 45%. And SC/ST is little lesser, 40% So this year, around 12 lakh students have qualified roughly for 1 lakh 18,000 seats. So the NEET counseling is held for all India quota, 15% of the seats by the medical counseling committee, and for deemed university and central universities, which is through the medical counseling committee. Whereas the state university quota is done by the local state examination authority for almost 85% of the government seats and 100% of the private seats. So this is the latest statistics, which from the time I have myself been doing this session about since the last 4 5 years, about 35,000 seats have got added on. 60,000 roughly seats in 427 medical colleges and 58,000 seats in 353 medical colleges. Total number of seats is around 1 lakh 18,000 seats in 780 medical colleges. So the various fees, etc., is different for different quotas, varying from about 3 to 4 lakhs in a government quota government seat, or even in some states is even lesser, but it can go up to now 2.5 crore rupees. So it's not an easy thing if you don't qualify well within the desired rank, and you have a bond also of plates, and then of course that's what I was telling you. The management seat quota is around 5 to 15%. With each year, the seats, the fees getting varied. So, because most of the students are from Karnataka, we have to understand that we have a private medical college quota seat here, which is divided into various NRI or and other person of India, Indian origin. So there are different sub quotas um, in this management quota. And for the private colleges, you need to apply through the Karnataka Examination Authority, which does the UG counseling for MBBS admission. Of course, this opportunity is there, but of doing MBBS in foreign countries, but it's more now. It's initially there were very few colleges and very few students are going, but now like everything becomes so popular. That means to say that there is something with it, and now it's almost become a sort of a scam. With so many small colleges mushrooming even in these states to cater outside of India in these countries to cater to students from India. So I always suggest that you be very careful when you're opting for this, because to come back and write the examination in India is very difficult and to clear. And to unless you practice that license examination, you cannot. Unless you clear that examination, you cannot practice in India legally. So what are the other career options? Yes, after MBBS, there's so many options. And What are the options after MBBS? For students who are pursuing uh, other options in healthcare is that you have Bachelor of Dental Sciences, and it is also need-based examination. And around 325 colleges are there in India with post-graduation courses, and it's 4 years for yes, 1 year internship. You have dental anatomy, oral pathology, prosthodontics, operative dentistry, orthodontics, periodontics. Of course, from the last few years, dental is again become very lucrative because you have so much of social media and people wanting to look have a perfect smile and so on. So there is definite demand for this, and there's a very everybody wants the teeth to be restored, and they want to be wanted to be preserved, and not like earlier where they would not mind having a few tooth off their set, but you can definitely keep it as an important option with the post graduation in mind. And of course, Ayush, which has been heavily promoted also from the government, which has around 50,000 seats, a substantial amount of seats. In preference, I mean, if there is a choice for somebody, I would prefer them to take this Ayush seats instead of the foreign degrees, because Ayush is recognized in India and there are a lot of promotion to pursue Ayush degree, and some amount of protection is there from the law to practice safely in the country. Most of the primary care physicians now in our country are from this stream, because MBBS people want to pursue post graduation. So there is a lot of opportunity to have your own setups and do yeoman's justice, especially at the primary care level. If you are well trained and you have the jasba for some service, always this is a safer safer way of going about things, and there's a reasonable number of colleges within our state itself which are offering Ayush courses. So the NEET scores are taken for consideration, and through the Karnataka again, it is through the KEA website, and a huge number of seats are available for this. NEET marks are not a consideration for this. So beyond these three main disciplines, you have paramedical courses, because healthcare is not only dependent on doctors; it's an interplay of teamwork between doctors, nurses, and paramedical staff. So individually we are a drop, and together we are an ocean. This holds good, especially for our healthcare sector. where teams are the ones which perform and do the needful. So, what are the various paramedical courses? Uh, mm, so, like I was telling you, they have so much of avenues because they are in respectable positions, and this skill force makes them more employable. See, these are all very practical courses. They are not dependent on the theory which we regularly see. So they become more employable, and it gives them opportunity to be independent in the sort of system which we see is so interdependent. So they can, after they gain some skills, they can definitely pursue their own dreams even outside the country. And and it's not very difficult to join. Like there are so many options. Like you have PUC, post PUC, you have the 2 year diploma course, or after the SLC, you have the 3 year diploma course. Or if you want to, this is for the diploma courses. Or if you want to opt for BSc, then you have the full postgraduate. I mean, the full graduate program, where you get the BSc degree, bachelor's program, and after this you can pursue even MSc in so many of these fields like medical lab technology, operations center, etc. We will discuss about this more elaborately as we go forward with this discussion. So coming to medical lab technology, this was a evergreen field for a long time because the requirement of the laboratory tests with each passing day for 15 years is kept on increasing because no disease or no uh, diagnosis can be arrived without a battery of tests. At least the basic tests are mandatory whenever we see that any diagnosis is to be made. So this is available in many colleges. There are different streams which you can opt for, even in medical lab technology. Especially after your 3.5 years, you can pursue microbiology, or you can pursue other specific MSc courses like oncopathology, etc. Then coming to radiology services, which is called as imaging technology. This again is a very useful course where PSC course can give you basic exposure to how to take CT scans and X-rays, etc. And when you go on into a master's in this field, you can become extremely well trained to help in taking MRI and other such advanced imaging services. So this again is available in a battery of colleges, and it's worthwhile, especially for boys to pursue. But like I told you, your goal should be to do a master's because that makes you get into niche areas and extremely high skillful, not to stop at basic PGC degree. And see the demand, see 5,000. 500 OMR is a big sum. It's not a small amount. Almost many of these countries are requiring extremely skilled workforce. So you should look at pursuing these courses. Then, like the dialysis technician, see the number of patients who are developing renal failure is quite high these days in view of hypertension and diabetes being common disorders. So dialysis is a mandatory thing for so many renal failure patients, and without the dialysis technician, this mission is useless. So you can pursue dialysis technician course, paramedical course, which will help you to work in centers which have dialysis machines. Then comes the cardiac care technology, which is an extremely useful course, especially for girls to pursue. And They are required to help cardiologists arrive at a diagnosis using various investigation modalities like echo, ECG, TMT. These are all tests which are done by these technicians. And like I told you, the more the need for diagnosis, the more the requirement for these basic tests, which are commonly done these days. Then cath lab technician. This also is a very useful course for students who are interested in doing paramedical courses. Like this machine is operated by a technician who helps the doctor to do the battery of tests in this machine. And now with cath labs being used not only by cardiologists but other departments like neurology and vascular surgery and even gastroenterology to some extent. These are useful programs which our students can enroll into. In fact, I have just focused on the top 5 paramedical courses, but there are many more paramedical courses like audiology and speech and hearing and emergency care technicians and gastroenterology technicians. So there are many niche areas which, if you want specifically, you can get into and get trained, and there will be a lot of demand because like I told you, these are healthcare is an interdependent field, so many of them will be dependent on these technicians to help and get their diagnosis and treatment of patients. Then pharmacy, which is a evergreen course and which has diploma, bachelor's, masters, and now the new latest PharmD, which is a 6 years course. So the criteria is same. You have to have a 10 plus 2 years in science stream, both for diploma and for bachelor's, and requirement of PCB, sorry. And there was the entrance test is basically the state level entrance test, which again in Karnataka is done through the Karnataka Examination Authority. So NEET is not mandatory for this. Then coming to BSc Nursing and GNM, which I always request students who are the early starters in their families who are the first graduates to take this extremely useful course because you have a lot of opportunity to do service to humanity. At the same time, you can be the people who change the course or trajectory in your families by earning a handsome amount of money because these are recession-proof programs. In the same see, like you may see people who have done other fields like diploma engineering or even engineering and so on. But sometimes the employability becomes a challenge, whether if you have not got the correct campus recruitment or if you have not got good jobs upfront, it may become a challenge for you to uh, get employed. Whereas a nurse, it's always evergreen. The world over, there's a huge shortage always. Only thing is, you should have a focus and you should have a goal and you should train in such a way that you become extremely skillful and the demand for your skill is there. So it is not very difficult to join. There are so many BSc colleges and government quota is also there. Fees is also not much. It ranges between 10 to 60,000, and duration is the same, 4 years of BSc. Why I am always in favor of students doing BSc, especially boys, is that initial days, yes, there will be little bit of struggle, but when you remember the hadith of Huzur Sallallahu Alaihi Wasallam, the gist of it was that the service person who is doing service, imagine the 70,000 angels will be praying for you, and you can, really uh, go to the corners of the world, the whole of Europe, Australia, all these places are open for you. The Gulf is also, so much of demand is there. So you should seriously contemplate to take this course because you can settle down in a very short span of time by taking BSc. And there's so much of growth with MSc nursing, that you can be service administrators and nursing superintendents, and you should look at the larger picture where there are nursing colleges also where you become teachers, faculty. So these are all the other benefits of just pursuing a BSc course, because it's a evergreen field, and not only in hospitals but in other teaching department also, there's always a demand for BSc and MSc nursing. Like I already told you, job prospects are there worldwide, and every country is in need of trained nurses and healthcare professionals. So wherever you go, there will be a requirement, and there will be a requirement of some or the other hospital always. So I sincerely suggest that you take up this seriously. Then physiotherapists who are now a huge part in healthcare, they help in restoring the movement and function when somebody is affected by injury, illness, or disability. So you help in people who have accidents, or who undergo knee transplant or hip whatever ortho surgery, that is bone surgery, they need rehabilitation, which is done by physiotherapists. Then other surgeries like cardiac, neuro, and other surgeries also need physiotherapists for post-surgery rehabilitation. Then there are some departments which specifically require respiratory therapists to help them to prolong the life of patients, in the sense by teaching them these exercises and being a partner in their disease throughout. For example, in lung diseases, many lung diseases don't have cure, but most of them will be managed with just physiotherapy. So you can take up this as a serious career option, and then we have occupational therapy and speech therapy, which again help in rehabilitation of sometimes post-surgical patients, or even for that matter in some special children who have got some disability for which they would have got treated with either cochlear implant or some other form of intervention for their hearing problems or speech problems. So these also very few people pursue, and once you get into these programs, you'll understand the demand, and you'll go forward in this course. Again, it's a 4 years postgraduate. I mean, this bachelor's course with 6 years internship. The admission is through KEA, and around there are 90 colleges in Karnataka with 20% of the seats for government quota. Fees ranges from few thousands to even lakhs in private colleges, because the demand, especially from outside our state, is very high. So a lot of people get into private colleges to pursue physiotherapy. Like I was telling, these are all courses which are having a reasonable salary, and they can also do masters and also get into teaching, because all these courses have a specific criteria for the teachers, and not everybody can become teachers in these colleges. So the people who want to have a career in teaching can also pursue BSc in physiotherapy. Then coming to some pure science courses, which has a huge demand outside, but not many students get into it because of the lack of glamour in these programs. Everybody wants to become a doctor, everybody wants to wear a stethoscope and apron, but actually life is not made by just a homogeneous group of people. Allah has not sent everyone to become doctors, and it is not required also. And the only person who is glamorous is the one who has taqwa, and who has the akhirat mein who becomes kamyab. He is the one who has got the real glamour. It's not the ones who are roaming around in big cars and who are having that so-called false prestige in the society. So you should not look at your life as a consumer, or as a person who is there to show off, but as a contributor. So STEM are the ones who actually run the basic sciences, and they are the ones who do the research and take things forward in this world. But we should look at the larger picture, and we should pursue our passion. So if we are, really not uh, 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 interested in non-biological fields, like not interested in mathematics, then definitely if you are not getting a MBBS course, you should not be disheartened, because you can do a huge contribution in this basic sciences course, and you can become a medical physicist, which complements cancer specialist, or you can do food science, where you can work as dietitian or food safety managers and product supervisors. There are so many things which you can pursue if you take pure sciences. Like I told you, there's a battery of courses in pure sciences: microbiology, food science, forensic analysis. Everyone wants forensic analysis of so many things, like cyber crimes have increased. So forensic analysis again is a niche area and specific to a field. No, not everybody can do it. So you can, look at these pure science courses if you are interested in pursuing something passionately. Because, like I told you, it is not very glamorous. So obviously, it will be a very dry subject. But if you are passionate, the limits, the sky is the limit, inshallah. So see, these are colleges which none of them, even would have thought about, and but like these are the places where you have these top courses, and it's not easy to get into these programs. You should be extremely competent and should have got very high marks. But then imagine that if you get into these programs in these research-based institutions, somewhere or the other you will have a high chance of getting employed, and these are programs which are much better to do than to just take a course for the sake of taking it. For example, to pursue MBBS outside of India, then trying to re-establish. If you put so much efforts in doing these courses in these prestigious institutions, then you will have a career for your own very early and in a much easier manner than making the life a whole struggle just to add two letters in front of your name, and to sort of be of something in the society. The people who contribute, whichever field they are, become a name in the society, and at least in the front of the eyes of Allah Subhanahu wa Taala, they will be recognized. But the criteria is that they should have contributed something back uh, to gain Allah's pleasure and to help the society. So these are all courses in which you can do it, and you can, take things forward. But you should be really interested in pursuing these courses with a lot of hard work and passion. Then, of course, coming to the veterinary sciences, this also nowadays has huge demand. Sometimes I feel they are in more demand than doctors, because of changing times. This is a 5.5 year undergraduate program, and people who have got 50% in PCMB, they are eligible for the colleges in Karnataka through KUA. There are only 6 colleges, and most of them are government colleges. Through NEET also, there's a 15% quota which decides the All India quota placements to this NEET examination. But the admission in Karnataka is based on PUC marks, and fees ranges between 50,000 to 2 lakhs per annum. So I was telling you that times have changed, and see, these are something called as pet parents. So I feel the number of veterinary colleges may be equal to the number of pediatric courses which are required, because there's so many people, so many want to know as be known as parents of pets. So there is cat, dog, and so on. So many of them want to be identified as parents, so they take care of the pets like their own children. So who takes care of them? It's the veterinarians. So sincerely request students who are able to crack this uh, through the KEA to take veterinary sciences. A lot of demands, lot of hospitals, and things like that. which are opening up. So you can have your own hospital, you can have your own setup. So seriously pursue taking up this course. To coming to an end, we have to identify that what is our purpose in this world, and we have come here as the Khalifa of Allah Subhanahu wa Taala, and our necessities are fulfilled by Allah Subhanahu wa Taala, and desires will be postponed, should be postponed for the Akhirat. And our purpose of life is that we are here for ibadat, talim, khidmat, and dawat, and we are not here just to, do some time pass and finish the days in our world and go back. But when we go back, we should go back after having satisfied Allah Subhanahu wa Taala. When you take the steps to do something, Allah's help will come. There are many scholarships, and everywhere there are people who are trying to support you, trying to help you. It is for you to reach out, and then there is reservation. This is something which we all should be aware of. Economically weaker sections in government of by the government have reservation, and 27% reservation for OBCs in all government colleges. This is through the All India quota, and you should take care of this. You should be aware and utilize this if you want to take advantage of the government schemes. Don't miss namaz. Namaz is something which calls you towards success. 5 times a day. You should ensure that whatever circumstances you don't miss namaz, and ask for Allah that Rabbi zidni ilma, Allah increase me in knowledge, and ask for Allah for knowledge which is of benefit. Allahumma inni as'aluka ilman nafi'a. So whatever we pursue, it should be of benefit to us, to the humanity, and for our larger cause. So we should ask Allah for help. And always our intention, like I told you, our goal should be very clear. And in the Malamala Binya is that it says that the rewards depends on the intention, and every person will get reward according to what he has intended. We have a big zimedari. There's a huge challenge. See how people are suffering because of our religion, because of our iman. We are, sometimes having to face so much of problems. So he will sort it out. It is us who will help our community and the society at large. And we should like for our for other brothers what we like for ourselves, and we should give them dunya or akhirat ki dawat, and inshallah we should stay away from this biggest challenge of our time, social media, brainwash, and distractions. This does nothing but wastes your time, and in the end, what do you have? You have incompetent princes. So when you ask somebody what does he want to do, if he says that he wants to fight a battle on the mobile phone, he is an incompetent prince. You should have the guts to have at least represented yourself in the real battlefield. So, what is the point wasting time on mobile phone and you know spoiling our lives? And we should stay away from all sorts of sins. Knowledge is a light, and Allah and the light of Allah is not bestowed upon a sinner. Imam al Shafi ka qawl hai. So ensure that you detest from all sorts of sins, so that Allah bestows you with all His rahmat and barakat in your courses. So, of course, planning and thinking is greatly influenced by parents and their upbringing. So, the parents, I sincerely request you, the ones who are attending this program, that you counsel your children to make them something which will, help them to contribute to the society than just trying to achieve that money and fame, which anyways Allah will give as much as is written in our Muqaddar. And we should ensure that where our children are spending time, they should spend time with the right place and places which they spend the time. They should not be loitering around here and there. You should ensure that the company and the places where they spend time is known to you, and it should be always towards a good cause. It should help them in the dunya and after, and they should be counseled to avoid all media and social media which is of no benefit and distractions. So don't make them selfish gooses. Zindagi ke chhe nishan, roti kapda makan, biwi bachche bekan. So they should not become selfish users, but in fact, the other way they should be contributors. They should be, we should promote a selfless generation, as success has nothing to do with what you gain in life or accomplish for yourself. It is what you do for others. So ensure that you bring up children to become contributors, and don't worry about the future. Trust your unknown future to your known creator. Have tawakkul. Allah will not कुछ भी जाया नहीं करेगा. Inshallah Allah सब कुछ अच्छा करेगा. All that makes a difference is your intention. So Allah's prayer and service to mankind should be your intention. I told you sky is the limit. These are some of the courses which you can pursue after a post graduation in MBBS. So there is no limit for what you want to achieve. तो शाही है परवाज है काम तेरा और सामने आसमां और भी है. जज़ाकल्लाह खैर. Over to Saif. You can mail me if you have any doubts, and in fact, even you can call me if you are having any doubts with the presentation which I have made. Inshallah, I'll see how best I can help you.
Sir, Assalamu alaikum.
Ji, walaikum salam.
Sir, I have one doubt here. If a girl child, if she's planning to appear for physiotherapy, is it good for in her future? And is it compulsory whether she has to completed masters also?
See, any of these fields, all of them have their advantages and disadvantages. Definitely, the advantages of pursuing fields like physiotherapy and others are that, see, there is no night duty, for example, in physiotherapy, because nobody comes in the middle of the night for physiotherapy, and they can be independent. They can be associated with so many doctors who are having clinics. And like I told you, any field, our patients, female patients, we will prefer them to have female nurses, female doctors. So similarly, female physiotherapists will be required. See, this knee surgery and also many women would have got done, and they would want a female specifically than a male to help them. Any course you take, all these courses are very useful provided you excel in them. You do really well, and masters should be pursued because I feel that it adds on to your knowledge and it adds on to your skills. So we should not worry about another 1 or 2 years. If you are able to get a good job before that itself, it's up to the person, but the basic course is going to be there with you. So when you do the basic course, that is the bachelor's, you will be known as a physiotherapist. With that, you can pursue whatever you want. You can be attached to maternity hospitals, or you can be doing orthophysiotherapy and so on.
Okay, sir. Sir, as per your experience in MPT, which is the best course which we can opt for MPT, sir? In which field?
This specifically for masters in physiotherapy, I am not aware. You can mail me. Inshallah, I'll find out and I will let you.
Okay, thank you, sir. Jazakallah khair. ये है अपने पास ठीक है चलो वाणी चल
Anyone else if was having some questions?
Assalamu alaikum, Dr. Sadiq. My name is Javed.
Walaikum salam, sir.
I just really want to thank you for such an excellent talk. Frankly speaking, I have been doing counseling for engineering and other places, and this is probably one of the most educative talk I've heard in my last 5 years. It is so comprehensive, so detailed. I am extremely delighted to attend this session. Thank you so much. This is massive. I don't know how much value people are able to take back, but I definitely will take back massive value from this session. Thank you so much, Dr. Sir.
Jazakallah, I thank Almighty Allah and then the organizers for arranging this session for me, especially Saif Bhai, who is really working hard to utilize the online space. Jazakallah. Over to you.
जी जज़ाकल्लाह खैर डॉक्टर साहब, very nice, very informative, mashallah. I hope all of us got lots of knowledge from your very brief talk, mashallah, and it will be helpful for all of us. Do we have any last questions from the audience before we close this session? Otherwise, Dr. Saab has shared his contact details.
Excuse me,
request
sir.
to yes.
In today's developing world, it is good to pursue in BMS courses.
Yes, madam. I presume that you're asking about allied health and this Ayurveda, Unani, and homeopathy. Yes, definitely it is useful. You can join with your PU marks, and then you can be the primary care physicians. So whenever the patients have the basic problem, they will come to you first, and then from there on you can refer them and treat them. Many patients will be treated in your hands, inshallah. And like I told you, the primary care physicians see more number of patients than the people who are at the top of the pyramid, because you are pursuing something which not many people are ready to do. So inshallah, yes, you can definitely utilize it, inshallah.
Okay, Jazakallah, sir.
Okay, Dr. Saab, thanks for your valuable time. We'll close this session and people can connect with you later, inshallah.
Okay, Jazakallah, sir.
Jazakallah. Assalamu alaikum.